the need for endotracheal tube care, don personal protective equipment, and raise the bed to a comfortable working height. Place a towel across the patient's chest to keep the gown from becoming soiled. Turn on the suction device and adjust the regulator to the appropriate setting. Perform hand hygiene and don gloves. Start by suctioning the patient's mouth and airway to remove excess secretions. Use a Yonkauer suction catheter to provide this care. Protect and secure the Yonkauer suction catheter, remove gloves, and perform hand hygiene. If you are using a commercially available securing device, remove it from its packaging and make sure the neck strap is in place and the Velcro strips are open. If tape is used to secure the device, prepare it at this time. Don gloves. With assistance holding the endotracheal tube in place, carefully remove the securing device and bite block. If tape is used, remove remaining adhesive from the patient's face at this time. Beginning on the side opposite the endotracheal tube, clean the patient's mouth, gums, and teeth. Use the Yonkauer suction catheter as needed to remove secretions. Note the centimeter endotracheal tube marking at the patient's lips or gums and carefully move the endotracheal tube to the other side of the mouth, making sure its depth remains the same. Clean the patient's mouth, gums, and teeth on this side of the mouth. Wash and dry the patient's face and neck as needed. For male patients, shave as needed. If tape is used, apply skin protectant as indicated. Place the Velcro strips around the occipital region of the patient's head and pass the endotracheal tube through the opening of the device. Confirm that the endotracheal tube is at the correct depth by verifying the centimeter marking at the gums or lips. Attach the Velcro straps at the base of the patient's head, leaving a ½ inch of slack in the strap. Ensure that the tube is secure. It should not move forward from the patient's mouth or backward down the throat. Also, check for any pressure areas on the patient's mucosa or on the occipital region of the head. If tape is used to secure the device, place the long piece of tape underneath the patient's neck with the double-faced portion resting against the neck and extending from ear to ear. Secure one side of the tape to the patient's face over the lip to the endotracheal tube, or from ear to nares for a nasal endotracheal tube. Tear the remaining tape in half lengthwise. Secure the bottom half of the tape across the upper lip or across the top of the nose. Wrap the top half of the tape around the tube at least twice to secure the endotracheal tube. Gently pull the other side of the tape that is around the patient's neck and secure it to the opposite side of the patient's face and the endotracheal tube. With the device secure and the endotracheal tube stabilized, reattach the suction source to the inline suction catheter and assess your patient for the need to suction the airway. Remove the towel from the patient's chest. Remove your gloves and any other personal protective equipment. Perform hand hygiene. Document the appropriate information, including time of the procedure, type of suctioning performed, description of the secretions, including the amount, color, odor, and consistency, and your patient's response to the procedure. Perform hand hygiene. Don clean gloves and remove supplies used for the procedure. Continue to assess your patient for any changes as needed.